draped Paula such that her breasts are still covered and her lower body's still covered. And then I'm going to put the cream on her. So, using soft and yet deep touch, I just push the cream around. I want to make sure to get it into the sides as well. Now I'm going to put my arm over her legs in order to create a weight here to stabilize her legs. This hand slides up the edge of the rib cage, right to the center, and then down to the belly button. So my hand is right here, it's resting on the edge of the rib cage, and then with pressure I drive down to the belly button, or glide down. Notice my arm is straight, giving a softness to my hand. Take a breath, please. Pause. Take another breath. And one more. Good. So with that, I was actually stroking the anterior side of her spine. Now I'm going to work with her diaphragm. So the diaphragm, of course, attaches right here, right under her rib cage. I'm applying pressure. Notice how I'm reaching out of my shoulders, how my arm is doing a reaching movement, not a pushing movement. That helps keep my hands soft. So I'm going to do 3 on one side and then 3 on the other side. It's a little trickier to get in on this side. This is the side of her body where her liver exists, right under her rib cage. It's a little trickier to get into the diaphragm there. Good job. Then I'm going back to the other side, and I'm going to work with her colon. So the colon moves this way through the belly, and I start with 3 circles going opposite of the way that the material flows through the colon to jumpstart peristalsis, or the digestive process there. Then I follow it up with 3 strokes going in the same direction as the flow of the colon. One more stroke here. I'm going to place my hand so that the center of my palm is right over her belly button, and this hand weights down her legs. Take a breath, Paula. My hand follows her exhale into her belly. Another breath. And one more. Pause, and then vibrate. This vibrates her spine. Also shakes up all the organs. And rest. Our upper chest area here. First I'm putting the cream on. You notice I have my weight behind me as I push across here. And weight behind me here. I'm going to do that same stroke 3 times. I come down on her sternum, so I ground with the bone and then push across. Once, twice, 3 times. And I'm going to place this hand here. The fingers naturally land between the rib cage, between the ribs, so that this stroke works with the intercostal muscles. And soothe. Now I'm going to the other side, slide across. You notice my elbow stays straight. I have a locked elbow, which allows my hand to stay soft so that I can give her a deeper stroke. This finger goes right under the clavicle. These fingers straddle the ribs. And I push and wiggle. I'm targeting the intercostal muscles here. And soothe. Deep, deep pause. So you see, as I roll backwards on the ball, my arms extend out of my shoulder sockets, allowing me to apply pressure down to Paula's clavicle here. Soothe. Just come in and check the movement in her head, in her neck. And I can take her this way a little bit more easily than this way. I'm going to do compressions now for her levator scapulas. They come right down the back of the neck. I'm going to catch and push. So again, this is coming from my hips. I catch the tissue with my fist, and yet then I push back. So I'm pushing myself away from her body and reaching out of my shoulder sockets. And pause. Good. Let's check her movement again. So there she goes to the right side. Better. She's going a little further there, going to the left. Good one. Okay, let's do a stretch for her. Okay, I'm going to turn her head all the way to one side and then to the other side. I'm rolling her head almost like it was a bowling ball. Okay, now I'm going to balance her head on my hand, put this hand palm down, slide it under her neck, and secure her shoulder. Drop your chin, Paula, and drop your eyes. Now I'm rolling her up such that the back of her neck lengthens. Make the back of your neck longer. Good. And then go back down. Now I'm going to take her so her nose goes towards her belly button. Drop your eyes, drop your chin, and lengthen the back of your neck. So I often will coach my clients while doing this move so that they go into the optimal position. Now we're going on a diagonal to the other side. Good job. Come all the way up, pause for a moment, and then come back down. And now I'm going to take and move her head in a full circle 2 times. And I have both my hands behind her head right now. The other option is to keep her balanced right here on my arm. And for some people it works better to keep their head balanced on my arm. And for other people it's a little easier if I just use both my hands behind her neck. Like that. I'm going for the other side now. I've got my hand in position. Drop your chin, drop your eyes, and I roll her up. Back down. Drop your chin and your eyes, and let's roll her up. The back of her neck's getting longer. Pause at the top. Roll back down, and roll up again. And all the way around. All the way around. Good job. here's the scalp rub in which my attention is on the bone, the skull. The texture, the density, the shape. Then the other side, same thing. Aha. If we could get this to let go, it will help your neck. So I'm just doing a couple little compressions right there, the back of your skull. Good. Now to the top of her head, I'm going to do a couple compressions here. This is the first time in this whole session that I'm doing a compression without a towel. Her hair creates the buffer, so I don't have to have a towel there. When I do these compressions, just like always, I'm pushing myself away from her. So I have my hand in position. As I apply pressure, you see my arm goes from bent towards a straightened position. It's not all the way straight, but it's in the straight direction as I push myself away from her. This last move, next to last move, I'm going to put my hands on either side of her sagittal suture or the center of her skull. I'm going to push, and then I'm going to let my hands cross. So with this push, the first motion, I'm taking the two halves of her skull and pushing them together. My hands will go under her hair, so you can't see it that well. But I push the two halves of her skull together and then slide across. Push the two halves together, slide across. Push, slide, push, slide, push, slide. I'm coming all the way back to the soft spot or the crown of her head. Then I'm going to return to the front a little bit faster. Good. My eyes. I'm going to make my hands warm, just a slight little rubbing together. Then the edge of my hand rests right on these bones here. Then I close the doors so that there's a little vacuum between my hands and her eyes. And again, my body's important here. So my elbows are together. If I had my elbows out, that would open space over her eyes. But when I take my elbows and pull them together like that, I'm able to let my hands rest softly and gently right there on her face. And I'll stay there for as long as I want, 10 seconds to a minute usually. And aloha.